All right, welcome back, everybody, to the brain injury discussion. This is your host, Jay. Today, we're going to talk about cerebrospinal fluid and hydrocephalus. Now, before we get started, obviously, when we talk about hydrocephalus, we need to talk about cerebrospinal fluid, and we also need to talk about intracranial pressure. And so, this discussion this week will be about cerebrospinal fluid as well as hydrocephalus. How do we get there? How is it treated? How do we identify it? But like always, sources will be in the description below. We'd encourage you to look those up, but we'd also appreciate if you give this video a like, maybe subscribe to the channel. But with that being said, let's get into this. So first, we need to talk about cerebral spinal fluid. What is cerebral spinal fluid? Well, it is an ultrafiltrate of plasma. Plasma is the liquid component of blood, and so it is part of a plasma function. And so, what does the cerebral spinal fluid does? Jay, what does this do, and why is it important? Well, um, it provides nourishment to the brain. It facilitates waste removal from the brain. Think about it. Anything that takes input, so like the minerals, like the glucose, like the oxygen, it creates waste. And so cerebral spinal fluid helps maintain that cycle. And also it provides another layer of protection for the brain. So think about it as another one of those fluids that is helping keep the brain stable. Um, this is also a fluid that is found in the subarachnoid spaces of the cranium and the spine. And so think about where this is. This is around the brain. This is in that subarachnoid area, and it's also connected to the spine. The spine, so it runs up and down. So, again, this is a type of fluid. There is a pressure in the brain, and we talk about intracranial pressure sometimes. Well, and rise in intracranial pressure could be from cerebral spinal fluid, which, if we break down this word, cerebro, which is the head, and then spinal, which is the spine, and it is, of course, fluid. And so, cerebral spinal fluid, when we talk about brain anatomy and brain injury, we should not necessarily forget about this. This isn't one of those very clear, this is a very subtle injury sometimes, although it may have some disastrous effects. So, let's continue. What are some of the dysfunctions that we might see from unbalanced pressures of cerebral spinal fluid? Or CSF, we might see what's called spontaneous intracranial hypotension. So if there's not enough cerebral spinal fluid, there will be a loss of pressure in the skull. We might see obstructive or non-communicating hydrocephalus. We might see communicating hydrocephalus. We might also see normal pressure hydrocephalus. And then we'll also possibly see hydrocephalus ex vacuo. And so this makes sense to talk about cerebrospinal fluid and hydrocephalus. We're talking about brain pressures. Just like you have a blood pressure, you have a brain pressure as well. And we want to maintain a healthy level of pressure within the skull. And this image that we see here is of a case of where the hydrocephalus really starts, and that is inside the brain, deep inside the brain, near the limbic system, near the corpus callosum, near a lot of these structures here. And so think about if that is swollen with cerebral spinal fluid, we could also see that there's pressure being put on those organs in the middle and to the rest of the skull. So let's move on. What is hydrocephalus? Well, hydrocephalus is an increase in cerebral spinal fluid inside the cerebral ventricles. Now, this is a example of a normal brain on the left in this graphic. Obviously, we see the ventricles right here. They carry blood and cerebral spinal fluid. And so what we have is a normal brain where that is just the right size, the pressure is there, just the right amount. The brain is, yes, under, there's fluids inside the brain. And so this is one of those fluids. But if we look at the hydrocephalic or the case of hydrocephalus, what we see is there is a lot of swelling in here because of the fluid. And so what that does is that we'll put pressure on these areas around here, as well as these areas around here, but also that's pushing the rest of the brain outward. And that is not good because the skull is a very rigid structure with bony ridges facing on the inside. We don't want the brain to be pushed into those bony ridges. We don't want the brain to be pushed into the skull. That is not healthy at all. And, when we look at the comparison, we see that there is a very big size difference between these two cerebral ventricles. But what we notice is that this is usually treated by a shunt, which is just a fancy word for vent, where you can vent that extra fluid out. So sometimes that increase in intracranial pressure, inside the skull pressure, we'll see that. And the symptoms of a hydrocephalus are quite interesting when you consider what they're pressing on in the brain. We might see cognitive decline. Maybe they're getting a little bit confused. You would probably be a little confused if your head was under a little bit of pressure, if your brain was touching or pressing up against these walls of the cranium or the skull. You might see that, or maybe the extra fluid in there is pushing on those inner structures. You might see that they have gait problems. Maybe they're walking funny. Now, that might be a sprained ankle. That could be a stroke. That could be any number of things. But maybe they're walking funny, but they're not showing that asymmetry in the face or the arms, or maybe they're not slurring their speech as much. Maybe they're becoming incontinent. Maybe they're not able to hold their urine as much. Maybe it's because there's pressure in the brain that would usually say you can hold it in, but maybe the brain is sending those signals to release pressure elsewhere, like the bladder. Also, we might see vision problems. Think again about the occipital lobe, which would be right back here. But now we see that it's under so much pressure, it's being pushed against the skull. And so we might see someone who has blurry vision, or maybe someone who is not seeing maybe 100% there. And so that's another symptom. And of course, when there's pressure in the head, you get headaches. Headaches would be a very common thing with brain injury, but especially so with hydrocephalus, especially given how there's an increase of pressure possibly within the brain. And the old joke goes, well, where's your headache located? Well, it's in your head. Well, it's all in your head. Um, Bad joke, I know, but think about those headaches. Think about these symptoms and how that might mirror other kind of brain injuries that might be related to intracranial pressure. And so when we take all this combined, let's find out what are the different causes of hydrocephalus? What are the different types? And so if we start with the types of hydrocephalus, we got communicating, which again could be caused by hemorrhage, possibly infection. Hydrocephalus can be caused by a traumatic blow to the head, or who knows, it could be possibly genetic. Maybe you're just predisposed to this. Maybe you have a lot more cerebrospinal fluid. But then you have the non-communicating types. So we might see like that aqueductal stenosis, the aqueduct where fluid is supposed to flow. Maybe that is stenotic. Maybe the fluid isn't going out quite as much. All right, that might lead to the buildup in pressure and fluid inside the skull. Maybe it's a tumor that's causing the hydrocephalus. Maybe the body's reacting to the foreign body or the neoplasm that is inside the skull. And so sending more fluid there to maybe try to irrigate. Who knows what the body is trying to do when you have a tumor. And again, this could be another one of those genetic things. And so the causes for hydrocephalus are quite varied, but all of which kind of points to a brain injury anyways. And so when you see hydrocephalus, which again, if we break down this word, hydro, think about hydrogen, think about hydrated, that's water, and then cephalus, which is ceph being head. And so what does this lead me as the brain injury case manager to conclude? Well, some brain injuries, again, they might be subtle. think about that person who's having maybe some vision problems. Maybe they have that abnormal gait, and maybe they're not as continent as they usually would be. That's why it's important to know the whole person. And so some of these brain injuries are quite subtle. And maybe it's not caused by a traumatic blow to the head. Maybe it was caused by genetics. Maybe it wasn't caused by an infection. Maybe it was caused by who knows what. Maybe it just so happened to happen. And so we need to be aware that these things can happen. But hydrocephalus, thankfully, is very easy to treat once it is identified. The way they usually identify it is they usually will tap the spine, specifically the lower spine, and what that'll do is that'll help relieve the pressure, but it'll be like one of those positive signs that whoever's doing the spinal tap will be able to say, oh, we just released the pressure. All of a sudden, they're starting to feel a little better. They're starting to walk a little better. Maybe they're holding in their urine more. Maybe they're seeing better. And so, again, having a shunt, which is another way to say vent, it's able to drain that extra fluid down into the body cavity. Maybe there's an inhibition there for the body to naturally do that. So a shunt makes sense. And so cerebral spinal fluid, again, it's a type of fluid. It's not something that we encounter on a day-to-day basis. If I get a paper cut, I'm not on my finger, I'm not going to be spilling cerebral spinal fluid, but it is possibly overlooked in the human anatomy and it applies a lot to the brain. And also, we need to continue to learn. We also need to prepare. We need to prepare ourselves and our brains to be able to recognize these things. And of course, so we can react appropriately. In doing the research for this, a lot of hydrocephalus, sometimes it's not preventable. But if we're able to identify when someone's off, we could get them the treatment they need much faster. And that's something that someone clinical or even non-clinical, if you see someone that's off, might be a good time to have that quick conversation to be like, hey, maybe you should go see a doctor. Hey, maybe something's off here. Maybe you should get that checked out. That's why it's important to know the whole person. Again, person-centered approach. But that will wrap it up for this episode. Those are my references. I encourage you to read those. Also, if you feel free to give us some feedback, either in the form of a like or maybe a comment. Maybe there was something interesting that you learned about cerebral spinal fluid. Also, we'd encourage you to subscribe to the channel. We put out this information weekly. We try to keep it educational, informative, but also very practical. And so, with that being said, I hope everyone has a wonderful day. And don't forget, protect those brains.